This is part one in a 5-part series about the parts of Medicare that you need to know about. In this first video, I'll start with one of the 2 parts of original Medicare, which is offered by the federal government, starting with Part A, which helps pay for hospital and inpatient care. Now let's take a deeper dive into some of the coverage and costs. Most of us have heard that Part A of Medicare is for hospital. Let's get into the details of what coverage includes. How about a semi-private room, hospital meals, skilled nursing services, care and special units such as intensive care, drugs, medical supplies, and medical equipment that you use as an inpatient stay, lab tests, x-rays, and medical equipment as an inpatient, operating room and recovery room services, some blood transfusions in a hospital or skilled nursing facility, inpatient or outpatient rehab services after a qualified inpatient stay, part-time skilled nursing care for the homebound after a qualified inpatient stay, and hospice care for the terminally ill, including medications to manage symptoms and control pain. So now you want to know what all of this costs, right? So most people will pay $0 a month for Part A. If you or your spouse made payroll contributions to Social Security for 10 years or more, you're going to get Part A for $0. But if you didn't have that 10-year work history, then you could pay anywhere from $274 a month up to $499 a month in 2022. Now, the deductible in 2022 was $1,556 per benefit period. A benefit period is defined as the period from the day you enter the hospital until 60 days after you've been released, meaning you could face this deductible multiple times in a calendar year. Now, once you've been admitted and you've paid this deductible, you'll have a $0 copay for the first 60 days for your inpatient hospital admission. Now, once you reach day 61, you're going to start paying a copay. That's $389 in 2022 for days 61 through 90, and $778 per day for days 91 plus. And after day 90, you have 60 lifetime reserve days, which you could use on Medicare Part A. And lastly, for this segment, on Part A skilled nursing facility, you'll pay $0 for days 1 through 20, but $194.50 a day in 2022 for days 21 through 100, with no coverage after day 100. And the scary thing about all this is there's no out-of-pocket limit for original Medicare, meaning those copays and deductibles will just continue piling up day after day, month after month for each calendar year with no limit. Stay tuned and follow for parts 2 through 5 coming at you soon.